What we're doing is we're redeploying staff that is in other sectors of the health system to better organize the zones, the cold zones and the hot zones, meaning that you have staff that is completely devoted to each zone. You don't have staff that is going from one unit to another or even to one establishment to another. So that's what we want to do in long-term facility, to concentrate the teams, to dedicate them to a unit in particular, and not to have people go from one unit to another. So this is a very important measure that we're doing. And also the testing that I've spoken about. We're going to test the patients and also the staff and the protective equipment that we're supplying as needed.
I think we started taking precautions very early. A few weeks ago, at the beginning, we stopped the visits. Unfortunately, they had some visits before from their family, and some of the seniors were infected. So we're dealing now with the workers, the people, nurses, the doctors working in those centers. We are testing them to make sure that they don't infect people living in these CHSLD or other places for seniors. But I think we expected that. I think we said it. Now 90% of the deaths are people of 70 years old and more. And of course, in CHSLD, people, they are already sick. So they are very vulnerable. But we're trying also to transfer some of the doctors and nurses coming from hospitals in those centers to help making sure that we control the situation.